Hi friends, in this video we'll look into details about celiac disease, its symptoms, how it can be diagnosed, what are the complications, how it develops and what is the treatment if any. And lastly, what is the dietary guidelines for celiac disease. So first we have to understand that what is celiac disease. Celiac disease is an inherited immune-mediated intolerance to dietary gluten. Then we must know what is gluten. Gluten is the protein complex present in wheat, barley, rye and to a lesser extent in oats. This gluten triggers the immune function. So what happens to the digestive system when immune function triggers? When gluten is ingested, susceptible individuals shows the intense inflammatory response within the small intestine. It damages the lining of mucosa or villus atrophy. When villi are injured, small intestine cannot properly absorb nutrients from foods, eventually lead to the malnutrition and other symptoms. Most people with celiac disease never know that they have it. Study shows that as few as 20% of people with it get the right diagnosis. The damage to intestine is very slow and symptoms are varied, that it takes years to get diagnosis until unless it became the serious illness. So I or you may have the celiac disease. How we get celiac disease and who is the risk of getting celiac disease? As told earlier, celiac disease is genetic. There has not been found a definite cause for celiac disease. It tends to run in families. If one of the close family have it, parent or sibling, then there is a 10% chance of getting celiac disease. Other than family to family, individual with some of the genetic disease has the risk of getting celiac. They are first one rheumatoid arthritis, Addison disease, Down syndrome, type 1 diabetes, Turner syndrome, and lactose intolerance. Let us see the symptoms in details. First one bloating, secondly anemia, third one heartburn, fourth one mouth ulcer, fifth one joint pain, sixth one fatigue, and then constipation and diarrhea. One must know that it's not same as food allergy because sometimes symptoms may appear or may not after ingestion, and it varies from individual to individual. If you're facing a similar symptom occasionally or continuously, then definitely it needs to be diagnosed. Let us see the diagnosis. There are two blood tests help to find out if you have celiac disease. First one, serology test. Here testing for immunoglobulin A CTG specifically for that antibody is detected. Second one, genetic testing, specifically looking for human leukocyte antigens. If the blood test shows that you might have celiac disease, then there is need to do endoscopy. Here doctor can look at small intestine and take a bit of to see whether it is damaged. Sometimes symptoms will not be visible and in later these may lead to the several complications. So it need to be treated. So let us know the complication. First one, celiac disease may lead to the bowel cancer. Second one, if celiac is not treated, damages the tooth enamel. Third one, there is a risk of getting osteoporosis with celiac. And fourth one, celiac disease also may lead to infertility. So the treatment is necessary to avoid further complications. No drugs treat celiac disease. The only solution is to avoid gluten diet. Avoid foods are typically made with grains like wheat, barley, rye and oats. Wheat-based products are bread, pasta, rotis, cookies and biscuits, cakes and pastries, beer, sauces and noodles to be avoided. When eating packed food, look for gluten content. Most of the packed foods mentioned about the gluten, whether it's gluten-free or not. So if you face any symptoms related to celiac disease frequently, don't neglect. Get diagnosed and treated. I hope this video is useful to you. For any suggestion, put in the comment box, and if you have not subscribed yet, please subscribe to my channel NutriJug. Thank you for watching. For more videos, click the link below given in the description. See you again with more videos. Bye bye. Take care. Have a good day.